Yeah, good morning and good afternoon, good evening, all of you, ladies and gentlemen here. I'm Ramesh from TBAI at India. So I'm just giving a brief intro about the Community Connect which we are here for. This is one of the featured program supported, funded by Stop TV Partnership, which was envisaged to engage informal providers, otherwise called unofficial providers, especially for screening all the TB symptomatic individuals and counseling them for TB testing and then referring them to nearby government TB testing facilities. So in this project, we have empaneled almost more than 1,500 informal providers onto the project, and we have trained them and we have used their services for systematic screening of TB among their OPD client loads. So in this project, especially the two key features are like technologies. One technology is basically to enroll the symptomatic individuals and tracking them for TB testing. That is the mobile application, the technology we have used. As soon as the informal provider enter the details of the symptomatic individual, the respective project staff gets the alert saying that so and so informal provider has referred one symptomatic individual for further follow-up. And basing on that intimation, the project staff follow up the symptomatic individual, counsel them, and then provide the support to connect into nearby NTP facility, that is TB testing facility for TB testing, and ensure that they get tested for TB. So this has addressed basically the two important components of the TB program. So one is early identification of symptomatic individual for TB testing, and the second important component is doctor shopping. So it addressed doctor shopping because as soon as the symptomatic individual entered into the mobile application, then the immediate follow-up has been done by the project staff so that they are not lost in the follow-up. So they have facilitated for TB testing. That's where it has addressed catastrophic cost of individuals as well, apart from addressing the delay in the TB testing. So this is technology which has used across all the informal providers who had smartphones, Android mobile phones, where in which the application was installed and used for connecting the individuals with the TB-like symptoms for TB testing. So this has given a very good results, and in the during the course of my uh, recording, you will be able to understand how that has been impacted in terms of reaching many symptomatic individuals for TB testing. And other technology that we used was like taking the TB testing to the doorsteps of the community. And especially considering the key vulnerabilities of the communities, long distances, travel time, and addressing the wage component. So what we have used, like we have used mobile application or digital handheld X-ray for screening the symptomatic individuals using the X-ray films. So this basically conducted in collaboration with the TB program staff in the remote areas of the villages, where in which there was a problem in terms of reaching to the test facilities. So using this digital handheld X-ray machine, which has inbuilt artificial intelligence component as well, this gave us immediate suggestion saying that these are the symptomatic individuals who are needed for TB testing. So this is how these two technologies have been used in this program, and following by the recording clips, you will also able to listen to some of the key beneficiaries how they have been benefited from these two technologies. Thank you very much.
Good morning, all of you. I am Ramesh from TB Alert India, and TB Alert India is working exclusively for TB since 2004 in India. And through this platform, I would like to brief about TB Alert India. TB Alert India got very good expertise through both community engagement and private provider engagement, and working with the vision to see India free from TB. Title of the presentation is Technology and Me, where in which I'm going to share about two technologies that we have been innovated, especially to increase the case detection of new TB patients. And similarly, there are few beneficiaries and stakeholders who will be sharing their experiences of using the technology, how they have been helped by the technology, and how the technology solved their initial challenges of case detection. Before stepping into the technologies, I would like to give a brief intro about the project which we have implemented in the state of Telangana, the southern state of Telangana in India. The project is Ripen project, roping in formal private healthcare providers for enhanced TB case detection. And this was funded by Stop TB Partnership through TB Reach Wave 6 Scale Up Grant and being implemented by TB Alert India from October 2018 to December 2021. And the main aim of this project was to engage informal providers, otherwise also called unqualified, unofficial healthcare providers, and sometimes rural healthcare providers, for identification of individuals with the TB-like symptoms. And if you look into the rationale why we have engaged informal providers, in India especially, the informal healthcare providers are an important source of medical care for about 75% of its population of rural and semi-urban areas, as they live in the communities and have a close access to informal providers. And the persons with TB symptoms, especially from low income communities, are estimated to see the first an informal provider. And this is almost around 70% of cases because they are more accessible and affordable to them. And similarly, the informal providers provide a basic treatment to the patients and refer the patients to qualified healthcare providers or facilities for investigation or treatment. And most of the time, the TB care provided by them is characterized by non-diagnosis, misdiagnosis, delayed diagnosis, and sometimes inappropriate treatment as well. So, looking into all these uh, advantages of engaging informal providers, this project was envisaged to engage the informal providers, basically keeping the four objectives into the mind. And the objectives are like building the capacities of rural healthcare providers to augment efforts for TB case detection, and similarly to track to facilitate the individuals with TB-like symptoms for testing. And this is basically addressing the delay in TB testing while arresting the doctor shopping by the uh, symptomatic individuals. And this is where we have used technology one, which I'm going to brief you in detail in coming slides. And the other objective is to minimize out-of-pocket expenses of the patients for TB diagnosis and treatment. And this is where we have used technology too. And the last but not least, the important objective was to synergize the efforts of NTP with informal providers for improved coverage and sustained link. And if we look into the key project activities, the first and foremost important activity is the provider engagement. When I say provider engagement, informal provider engagement, especially for screening the OPD clients on TB symptoms. Here there are three major steps. We have started with the mapping of the informal providers, getting the details and briefly explaining them about the TB, and followed by initial pitching like introduction of the project activities and gauging their willingness and interest to be part of this mission of TB elimination. And then followed by we have enrolled the providers and provided continuous support to them to build their capacities in the form of initial trainings and refresher trainings. And also we have organized some of the experience sharing meetings where the informal providers have shared their experiences so that others can listen to them and others can adapt to the best practices which they were implementing. And apart from that, the project team has provided on-site supportive and guidance role to all these engaged providers on TB and other key importance of the project activities. And the second foremost important thematic area is beneficiary support services. So here starts the actual symptomatic screening of TB by the informal provider in a systematic way. And once they identified that an individual has TB symptoms, there are two channels here. And the providers who are using the smartphones are installed with the mobile application, which is a technology, mobile application software. And others, those do not have smartphones, they are provided with the hard copy referral forms, wherein which they fill the details of the symptomatic individual and refer them to the testing facility, which is an NTP facility close to their area. Here, the mobile application will work as an immediate auto connectivity with the symptomatic individuals, wherein which once the details of the PTS enrolled into the mobile application, immediately the project staff, like the project coordinator, gets an alert of PTS details, and then taking that as a reference, he contact them and counsel and facilitate for TB testing. This is how the immediate follow-up by the project team is done to motivate and counsel and facilitate them for the TB testing at nearby NTP facilities. This is how the technology works. Like this is the mobile application which is installed among the providers who have smartphones. And once the people visit the informal providers, he assess them on the TB symptoms. And if he identify them having any symptoms of TB, then counsel them and refer the PTS for TB testing. And simultaneously, he enrolls the details of PTS into the mobile application. The basic details like name, contact number, and where he resides. And soon after that, the project staff gets an alert indicating that so and so informal provider has entered the details of PTS for follow-up. And taking that as a reference, project coordinator call them and motivate them and facilitate for TB testing. This is how the application works. And with this technology, we have reached use beneficiaries, especially for facilitating for TB testing. And if you look into the provider reach, out of 1635 providers who were engaged into the project, of them 1524 were using the mobile application for PTS referrals. And after the project closure, like we have closed this project by 31st December 2021, around 720 active providers. When I say active, we have considered the providers who were referring PTS in every month are now linked with the NTP staff for PTS referrals. This is how they have been, their support has been linked to NTP for sustained reach of the beneficiaries. And the other important results from this innovation is around 37,775 PTS counseled and referred for TB testing by these providers. And you can see out of them, around 98% of the referral were tested for TB at NTP facilities. And of them, around 6,111 found TB positive, that is all forms as per the testing algorithm. And in addition to that, around 15,796 household contacts of TB patients. When I say TB patients, pulmonary TB patients were screened for TB, and of them, 738 found to be having TB symptoms and facilitated for TB testing. Of them, 83 found TB diagnosed. And as a public health action, around 21,000 PTS, those who were tested negative in their first TB testing, were followed up on recurrence of TB symptoms. And if found to be any people having symptoms, then followed up for TB testing. And all these 6,111 TB patients were identified by the informal providers referrals were notified under public sector using a web-based reporting system called Xair in India. And around 6,098 TB patients initiated on treatment and linked with NTP Cascade TB care prevention support services by the project staff and NTP staff in collaboration. And in summary, this technology basically addresses two important components of the program, that is addressing the delay in TB diagnosis and addressing the doctor shopping. The average TAT for testing was less than 2 days, I should say, and a collaborative action by the providers and NTP. We have clearly seen there is improved trust and synergy among these two important key players for new TB case detection. And now I am going to talk about the technology 2, which is a doorstep services to the vulnerable population of the project area. The technology is using portable handheld X-ray machine, which is enabled with the artificial intelligence software. And we have deployed the mission, the doorstep service of the beneficiary to meet the most at risk population, the key vulnerable population groups such as slum dwellers, industrial workers, daily laborers, because they generally ignore the symptoms and avoid visiting testing facilities due to various reasons, such as a fear of wage loss, no money for transportation, and fear of travel alone. And also, some people have hesitations to visiting TB test at government facilities. So, considering all these limitations or bottlenecks, we thought of using this portable X-ray, taking this portable X-ray to the communities, to the nearby uh, communities as a doorstep service, announcement by the stakeholders with the help of the local PRI members, Panchayat Raj institution members, and ASHAs, ANMs, giving the date and time of the camp, and then they mobilize the beneficiaries for the X-ray. And then the registration starts, taking the demographic details and other key information from the beneficiaries. And then the local ANM or doctor shares the importance of health, and they will brief about the X-ray and purpose of taking it. And then the actual screening using the portable X-ray will done. So that is taking the X-ray of all the beneficiaries. And if the medical officer is present on that day, he or she reads the X-ray and he suggests for uh, confirmation testing if they found to be having any X-ray lesions. And if sometimes if the medical officer is not available on that particular day, the soft copies were sent to the radiologist for reading the film, and the report will be collected back and informed to the beneficiaries. And if the pupil or beneficiaries found to be having lesions through X-ray, then they prepare the staff prepare for the other confirmation test at the NTP facilities. They do collect the sample and transport the sample and test for the confirmation of TB. And this is how the screening algorithm works. And you can see the image here, one of the X-ray image for your reference. And this is how the machine is in action. Right? They take the uh, X-ray and automatically it gets connected to the system with the details of their primary profile. And along with that, since it has inbuilt with the AI, it also separates the beneficiaries who are having lesions suggestive of TB. And this is how the beneficiary reach in around 6 to 7 months of the project implementation. This was actually implemented during the last phase of the project, during the last 6 months of the project from August to December 2021. You can clearly see here, around 53 camps were conducted in 53 villages of the project operational area, and around 3,312 individuals were screened for TB, and of them around 482 found to be having lesions. This suggests of TB, and all of them were referred for CB node testing. Of them, 367 were done for CB node, and of them 85 found to be bacteriologically confirmed. And when you look into the all forms TB patients, it is around 146. So this is clearly indicating like around 14.55 are found suggestive of TB. That is 482 out of 3312 tested for TB through X-ray, and around 30% found TB diagnosis, all forms out of total number of people found suggestive of TB using the X-ray machine. So that is 146 out of 482. So as I was saying, like all these uh, symptomatic individuals and also confirmed TB positives were notified using the web-based reporting system called Xair in India. And after the closure of the project also, this usage of the machine was continued with the support and collaboration with the local NTEP staff. And almost during May to September 2022, around 21 camps were conducted and screened around 1980 individuals for TB, and of them 330 found to be having suggestive of TB. And all the 330 were tested for CB naught, and of them 162 found to be having confirmed TB. Like 49% of symptomatic suggestive of TB patients are tested through CB naught found to be having TB. And in total, around 182 are the all forms of TB who were notified and initiated on treatment at nearby NTP facilities. This is how like a strong support has been envisaged and provided by the NTAP. Like all the 330 suggest for TB patients were done with sample collection and samples were transported to CB node and they were tested for TB. And the key areas it has addressed are, first of all, it has filtered the people by initial testing to identify whether they have any TB lesions or not. And then immediately facilitating for confirmation test and the sample collection and transportation. And that was done by the NTP staff. And the other important component of technology used was it addressed the out-of-pocket expenses of the beneficiaries because it gone to the doorsteps of the beneficiaries, hence they they did not spend any money for the testing and also any money for travel also. And to conclude, these are the few recommendations from the technologies used, especially for TB case detection. The technology one, that is mobile application, is very simple and easy to operate also. And it is very user friendly and it is a very good tool, I should say, to engage the informal providers, especially addressing the two important components of the country's national strategic plan, that is prevention and diagnosis, because it is addressing the delay in diagnosis. And it is recommended to enroll the informal providers into the public health reporting system of TB. So far, no informal provider were involved or were enrolled into the public health reporting system. In some form, if they are involved in these TB elimination efforts, we can channelize all the symptomatic individuals for TB testing. And with the technology too, the two important recommendations are fixing the day and time of the testing camp is very important to reach the maximum clientele. And basing on our experience, it is always preferred to have these camps on holidays or otherwise weekly hours of industrial workers or laborers. And other important aspects involving local health staff, Panchayat Raj institution members is very vital to make the people aware about the camp and also mobilize them for the X-ray screening. This is all about two important solutions we have used in this project. And going forward, there are some beneficiaries who have used this mobile application, like there are informal providers sharing their experiences of using the mobile application. And also there will be sharing by the patients who were benefited by these technologies. Thank you very much. And if there are any questions, I am happy to answer those questions. Thank you very much.
Working as a district TB control officer of this district since 6 years. We have a huge TB target of around 3,000 cases annually. To achieve this, we are taking the help of TBAI people, and regularly we are having X-ray camps because in diagnosis of TB cases along with sputum examination, identifying the patients by X-ray also is very crucial. So we are by this way we are accessible to the patients where simultaneously along with the X-ray, patient sputum sample is also collected and subjected to the NAT test. So by this way, we have almost done 20 camps, and among these 20 camps, we have conducted around 1,300 people's X-rays, and we are able to diagnose clinically around 323 patients, so which has been very helpful in taking our TB notification target to a higher level. X-rays have been very helpful in coming to a conclusion about the TB diagnosis also. The pictures are very clear, and simultaneously artificial intelligence is also incorporated into this machine. So if you have any doubt, we can fall back on this AI also and take the help of the AI, and simultaneously we are able to diagnose a lot more cases.
నమస్కారం అండి. నా పేరు సురేష్. మాది కామారెడ్డి జిల్లా రామారెడ్డి మండలం పోసంపేట గ్రామం. మా గ్రామంలో నేను 20 సంవత్సరాల నుంచి ఆర్ఎంపీగా ప్రాక్టీస్ చేస్తున్నాను. మాకు ఇంతకుముందు టీబీ కోసం ఎక్కువ తెలిసేది కాదు. టీబీ అలాంటి ఇండియా వారు వచ్చి మాకు కొంచెం అవగాహన కల్పించారు. దాని ద్వారా మేము పేషెంట్లోని లక్షణాలను గుర్తుపడుతున్నాము. పేషెంట్కి 2 వారాలకు మించి దగ్గు, జ్వరము, ఆకలి తగ్గిపోవడము, వారు బరువు తగ్గిపోవడము, అలాంటి లక్షణాలు ఉన్న వాళ్ళను మాకు అయితే టీబీ అలాంటి ఇండియా వారు ఒక యాప్ ఇచ్చారు. యాప్ ద్వారా మేము ఆ లక్షణాలను గుర్తుపట్టి ఆ పేషెంట్ యొక్క పేరు, చిరునామా వివరాలు ఎంట్రీ చేసేవాళ్ళము. తర్వాత అదే రోజా మరుసటి రోజా ఇక్కడ ఏరియా కోఆర్డినేటర్ వచ్చి వాళ్ళని తీసుకెళ్ళడం జరిగేది. వాళ్ళకు టెస్టులు చేయించి పాజిటివ్గా వస్తే ఒక 6 నెలలు మందులు ఇప్పించి వాడిపించడం జరిగింది. వారు కూడా బాగానే కోరుకున్నారు. వారు ఇప్పుడు మంచిగా ఆరోగ్యంగా ఉండడం జరిగింది. నేను ఒక 60 కేసులు పైగా రిఫర్ చేశాను. అందులో 20-25 పాజిటివ్గా రావడం జరిగింది. మరియు పేషెంట్ సకాలంలో వాళ్ళు ట్రీట్మెంట్ తీసుకున్నారు. మాకు కోఆర్డినేటరు టీబీ అలాంటి ఇండియా వారు బాగానే పనిచేశారు. మేము వాళ్ళతో పనిచేశాము. వారికి మా కృతజ్ఞతలు.
కొట్టకుమార్, రాలకత్తవ, వయసు 38 సంవత్సరాలు, జిన్నారం మండల్. అయితే నాకు ఇట్లా జ్వరం వచ్చింది. జ్వరం పెట్టుకుంటా చెమటలు వచ్చినాయి. చెమటలు వచ్చుకుంటే ఇట్లా దగ్గు వచ్చింది. అయితే ఇక్కడ మామూలుగా ఆస్వారా పెట్టుకున్నా, తగ్గలేదు. అయితే టాబ్లెట్ వేసుకున్న రోజులు తగ్గింది. తర్వాత మళ్ళా వచ్చింది. అయితే పడంచేరు ప్రైవేట్ హాస్పిటల్కి వెళ్ళాను. ఆడ టెస్టులు చేశారు, టాబ్లెట్ ఇచ్చారు. అవి వేసుకున్న కొన్ని రోజులకు నయం ఉంది. ఆడికెళ్ళి మళ్ళీ పడంచేరు వెళ్తే చందనగర్ హాస్పిటల్ రాసిరు. అయితే ఆడికి వస్తే హాస్పిటల్ చూసి 2 రోజులు జాయిన్ చేసుకోరు. అయితే ఆ 2 రోజులు జాయిన్ చేసుకున్నాక టెస్టులు చేసిరు. నాకు అన్ని టెస్టులు చేసినాక సిటీ స్కానింగ్ అవి అన్ని టెస్టులు చేసిరు. టెస్టులు చేసినాక తర్వాత నాకు టీబీ అని తెలిసింది. అయితే టీబీ అని తెలిసినాక నాకు ఇట్లా బయట ఇట్లా గవర్నమెంట్ హాస్పిటల్లో గోళీలు ఇస్తారు, టాబ్లెట్ అన్నీ చెప్పారు. ఆడిపోయినాక మళ్ళీ టెమ్డా టెస్ట్ చేసిరు. అయితే ఆ టెమ్డా టెస్ట్ చేస్తే నాకు టీబీ అని తెలిసింది. అలా చెప్పారు. చెప్పి నువ్వు ఇట్లా 6 నెలలు టాబ్లెట్ వాడాలి అని చెప్పి నాకు ఆడ టాబ్లెట్ ఇచ్చారు. మళ్ళా తర్వాత 2 నెలలు వేసుకున్నాక 2 నెలలకు మళ్ళీ టెస్ట్కి రా ఒకసారి అని చెప్పారు. సరే అని చెప్పి వెళ్ళాక కొంచెం తగ్గింది. అయితే బరువు కూడా పెరిగినావు అని చెప్పి మళ్ళీ 6 నెలల తర్వాత మళ్ళా రా అని చెప్పారు. అయితే సరే అని చెప్పి 6 నెలలు గోళీ ఇచ్చి వాడాను. 6 నెలల తర్వాత మళ్ళీ పోతే తగ్గిందని చెప్పారు. కాకపోతే చాలా ఇబ్బంది పడ్డాము మా ఇంట్లో. నేను కూడా చాలా ఇబ్బంది, 3 నెలలు లేవలేను. ఇట్లా మంచం మీదకి పైన ఇట్లా లేదామంటే నడవడానికి భయమైంది. ఇట్లా గోడలు పట్టుకొని నడుచుకుంటే పోయినా బాత్రూమ్ పోవాలంటే. అయితే మా ఇంట్లో 3 నెలలు అట్లా నేను ఇబ్బంది పడ్డాక మా ఇంట్లో కూడా మా భార్య కూడా మస్తు ఇబ్బంది పడ్డది. మా పిల్లలు కూడా భయపడ్డారు. ఎన్నెళ్ళు లేదు మా డాడీ ఇట్లా అయిందంట అని చెప్పి. అయితే 3 నెలలు గొర్రెకాడికి పెట్టాను నేను. ఆ 3 నెలలు కూడా గొర్రెకాడికి కూలీలు పెట్టిన. నెలకు 15,000 రూపాయలు జీతం ఇచ్చిన. నా పరిస్థితి చూసుకుంటే ఆయన కూడా 10,000 ఇచ్చేది, 15,000 తీసుకోండు అని చెప్పి ఇట్లా అడిగి గోళీ ఆడినాక తర్వాత 3 నెలలు మామూలుగా లేచిన. ఆడికెళ్ళి ఇప్పుడైతే నాకు చాలా మంచిగా ఉంది.
సార్ నా పేరు మల్లేష్. ఇట్లా పెళ్ళ మీద పనిచేస్తాను సార్. అయితే నాకు అన్నము ఆకలి కాకపోతే జ్వరం అది ఉండేది. మేడం వచ్చి ఎక్స్రే ఇక్కడనే తీశారు. తీసిన తర్వాత అది బాబు కొద్దిగా ప్రాబ్లం ఉందని చెప్తే ఉమ్ము పరీక్ష చేసుకుని తర్వాత అది రిపోర్ట్ అనేది బయటపడేది. ఇది ఎక్సైజ్ టీబీ ఉందని చెప్పేసినారు. తర్వాత గోళీలు వాడమని చెప్పేసినారు. మేడం ఉండి ఎరగడకి తీసుకెళ్ళి గోళీలు ఇప్పించేసినారు సార్. అప్పటి నుంచి కొద్దిగా ఆకలి కాకుండా ఆకలి అనేది కొద్దిగా అవుతుంది. ఇప్పుడు జర నన్ను పనికి కూడా పోవాలనిపిస్తుంది. ఎక్స్రం తీసుకోవడం వల్ల నాకు కలిపి వచ్చేసేసింది, అన్నీ క్లియర్ అయిపోయినాయి సార్. నాకు ఎక్స్రం వీడికి వచ్చి తీసినాకనే నాకు ఒకటి మేలు ఒకటి జరిగింది, పని ఒకటి వేస్ట్ కాలేదు, డబ్బులు కూడా పెట్టడం తగ్గిపోయింది.
ఇక్కడికే వచ్చి ఎక్స్రే క్యాంప్ పెట్టడం వలన ఇలాగ మల్లేష్ లాంటి వాళ్ళకి చాలా ఉపయోగకరంగా ఉంది. ఇలా ఒకసారి ఎక్స్రే తీయడం వలన వాళ్ళకి ప్రాబ్లం చూసి మేము టెస్టులకు రిఫర్ చేయడం జరిగింది. దానిలో ప్రాబ్లం రావడం, టీబీ అని కన్ఫర్మ్ కావడం వలన మళ్ళీ ట్రీట్మెంట్లో పెట్టడం జరిగింది. ఈ టెస్టులే బయట చేపిస్తే చాలా ఖర్చుతో కూడింది. ఇట్లాంటి పేదవారు బయటకు వెళ్ళి టెస్ట్ చేయించుకోవడం అనేది చాలా కష్టతరంగా ఉంటుంది. అంతేకాదు వాళ్ళు చేసుకునే పనులు కూడా ఆటంకం కలగకుండా కంటిన్యూగా వాళ్ళు టెస్టులు మేము తీసుకెళ్ళి వాళ్ళకి టెస్టులు చేయించడం వలన వాళ్ళకి చాలా ఉపయోగకరంగా ఉంది.
Mr. Dosari?
And I'm there. Can you hear me?
Yes, sir.
Can you hear me?
Yes, sir.
Tell me, I have answered to those questions which are there in the question and answers box. Are there any other questions which I am supposed to answer?
Mr. Dosari, can you continue?
Tell me, Alexander, how should I take it forward?
Yes, please, sir.
Pardon?
You can answer the questions you have in the Q&A.
Yeah, I've tested the answers there. And the first question was like the technology was how the solutions were taken up forward. That was the question. But the challenge is we are like, since the project was got closed by December 31st, we have been doing some sort of extending some sort of support to the beneficiaries with the local philanthropist and NTEP support. But otherwise, we are desperately looking for some of the donors to fund for these innovations to continue for further reach. And the second question was answering like how the technologies were taken to rural populations of geography. Especially the second innovation, which was digital handheld X-ray, was focused towards meeting the required demands of the rural population, especially meeting them at their doorsteps by facilitating the X-ray screening. So that was the uniqueness of the technology too. And please tell me if there are other questions which I'm not able to see there, but I am happy to answer those questions.
Sir, if you click Control and minus, you're gonna be able to see all the questions in the Q&A, as it's gonna make the screen smaller.
Okay, I'm able to see only those questions. Uh, oh, Alexander, those are the 3, 4 questions. That's it. I'm not able to see further questions there.
Then, sir, you can conclude the session, and that's
Yeah, thank you all very much for your attentive listening to the my presentation and recordings. And thank you very much for your patient listening. Thank you all.